With me is Nancy McWilliams. She is a very influential psychoanalyst, writer, and teacher at Rutgers University. Her writings have been translated into over 20 languages, including my own, Portuguese. She is a former president of the Division of Psychoanalysis of the American Psychological Association, and I could go on with her accomplishment, but I would rather listen to you. So thanks for having us, Nancy.
Oh, my pleasure.
You had a long and fruitful career, and I think it would be nice to know a little bit about your early experiences in therapy. And even before that, like, can you tell us the story of how a political science professor and Freud's civilizationist discontents helped you start this journey?
Well, I've always been interested in individual psychology and individual differences, and I guess I didn't know there was such a thing as being a therapist or a clinical psychologist until I was high school or college age, and I thought I might study psychology at my college, which was Oberlin College in Ohio. But they didn't let you take the introductory course until your second year, and then they made you run rats for a whole year
Yeah.
before you got to talk about people in your third year. And it was a very demanding major, and I was interested in getting as broadly educated as I could. And in political science, they had a less demanding major. They were talking about people from the first year and why they did what they did. And so I became a political science major. And in my junior year, my advisor, whom, by the way, I later married, but
Ah, it all comes together.
that's the part of the story that in these times is probably considered a patriarchal abuse on his part. But in my era, it simply felt like I was a grown-up and I could seduce the professor.
Exactly.
So um, he came to me before we had any personal relationship and said, you know, you're very psychologically oriented. Why don't you consider you doing your doctoral, or not doctoral, your honors thesis
Yeah.
uh, in political theory on Freud's political theory? And he handed me a copy of Civilization and Its Discontents. And I became absolutely enchanted with Freud's mind
Uh-huh.
and began reading a lot of psychoanalysis. Um, I married the professor my senior year, and we had to leave Oberlin because there really wasn't any graduate opportunity for me. And I was clear I wanted to leave his field because at that time I thought I would always be Mrs. Carrie McWilliams if I stayed in political science. And I'd gotten fascinated by psychoanalysis.
Yeah.
So I started reading some more popularized psychoanalytic books in addition to Freud, including Theodore Reich. And when we moved to New York, I realized Reich was still alive. So I sent him a letter and asked to meet him. And he was very gracious and met me. And I asked him for advice about changing my career to being a clinical psychologist, and he told me I must be analyzed.
Of course.
Sent me to the institute he had founded when the MDs would not let him teach at their institutes. And so I began a psychoanalysis before I'd had really any academic training in much of psychology, or certainly in psychoanalysis. And it was a very good fit.
Yeah.
The analysis really made a radical difference in my life, improved my marriage. I don't think I would have had children if I hadn't gone through an analysis.
Wow.
So it happened in a kind of organic way, just by following what I was most interested in and most passionate about.
I still would want to ask you, I think it was Lou, his name, of the analyst?
Yes.
Yeah, I'd still like to ask a little bit more after, in a while, about that. But just before jumping into that, sticking with you talked about one of your early influences, Dr. Theodor Reich. He had quite a, for that time at least, quite a feminist stance in a way, and I think that might have appealed to you.
It did.
Yeah, I'd like to ask you, I would be curious, did being a female psychoanalyst at any point in your career, maybe early on or in general, do you feel was it ever a sort of difficulty in your career to be a female psychoanalyst in terms of career continuation?
No, I did feel that it was occasionally difficult to be a female in academia early on.
Ah.
But not in the psychoanalytic community. I felt that there had been, I felt that was the only professional community that had women as major thinkers and contributors almost from the very beginning. I mean, Freud was very explicit in learning a lot from people like 𝗔𝗹𝗲𝗅 and Sabina Spielrein.
Mm-hmm.
And was interested in, inducting his daughter into the field.
Yeah.
And there was, of course, then Melanie Klein and 𝗔𝗹𝗲𝘅𝗍𝗄 and Karen Horney and many other preeminent women in the field. Yeah. So in psychoanalysis, I never felt any sexism.
It was quite comfortable.
I felt there were some misunderstandings about women in
theory.
Yeah.
Yeah, but you felt that more in academia, you were saying.
I didn't feel I was ever treated as less than.
Mm-hmm.
And what I had liked about Theodor Reich's writing was, and it's funny because now some of it sounds a little bit patronizing to me, but he was the only person who was treating female psychology as different from male psychology and yet equally valuable. The typical tone in sex difference literature was that women were an exception to the male standard.
Yeah.
That we were the deviation
from the male norm.
Yeah.
Yeah. You also mentioned Karen Horney, which is a therapist, an analyst I personally love. Did she also have any sort of influence? Because she did write also about this topic of feminist psychology.
Yes, she did. I had numerous female heroes in analysis. 𝗔𝗹𝗲𝗅𝗍𝗄 is probably the preeminent one, but also Clara Thompson and Karen Horney, and later, as I learned her work better, Melanie Klein.
I'd like to now make a big jump in time, because in 2000 you wrote a wonderful article called On Teaching Psychoanalysis in Anti-Analytic Times. And you argued against the stereotypes perpetuated on analysts and the scientific validity of psychoanalysis. Do you remember when you first became sharply aware that there was this anti-analytic standpoint?
It was always there.
You always felt that?
Academia. I remember going to graduate school and, in personality studies, which is what I eventually got my degree in, I didn't feel it really strongly, but some of the faculty just thought that psychoanalytic thinking was garbage.
Yeah.
One of my classmates in 1970, who later became a close friend, found that I was interested in psychoanalysis, and he said, "Aren't you aware that that's been completely empirically discredited?"
Yeah. Mm-hmm.
So that was the party line even back then among certain academics.
So how did it change? Over time, because this still exists today. Is there any difference in the attitudinal stance, anti-analytic stance? Do you think it got worse, or is it pretty much the same?
It got much more powerful, partly because there were needed correctives to some of the arrogance and self-centeredness of psychoanalysis is the only way of thinking about people, something I never bought into, maybe partly because I was a political scientist and I was always looking at large systemic factors that influence psychology. But the family systems movement began, the behaviorist movement began, the cognitive behavioral movement began, the biological psychiatry movement began, and they all had legitimate angles of vision for understanding human behavior.
Yeah.
So as they elaborated, psychoanalysis necessarily faded as being the only game in town.
Yeah.
And I think it was good for psychoanalysis. Right now, though, I think the humane tradition of caring for the soul that is essential to psychoanalysis is very threatened, not so much by other orientations, but by the interests of drug companies and insurance companies and governmental cost cutters who want to believe you can do psychological miracles in a very short time. And any experienced therapist from any orientation will tell you that that's usually not possible.
Yeah.
It's possible in the laboratory when you have carefully selected a group of people with one DSM disorder not comorbid with anything else, especially when they seem to want to, cooperate with the profession. But in real clinical practice, psychotherapy is extremely complicated, and we'd all do well to be humble about our orientation. And yet we are up against pressures systemically that are pretty crushing right now.
Yeah, you've wrote very convincingly about this, and as you said, the predominance of randomized clinical trials and the need for short-term therapy in a way. There seems to be a contrast in a way. I remember 𝗔𝗯𝗲𝗅𝗍𝗄 talking about the difference between the medical and the contextual model. And in a sense, there seems to be like two philosophies of cure, let's call it, implicit in this discussion. When I read a book, you have a chapter on a book called Creative Breakthroughs in Therapy. You talk about a difficult case, and you also say that when you were in analysis, there was a moment when your therapist, your analyst acknowledged a mistake, and that touched you more than any of his brilliant interpretations.
Yes.
And as I was reading this, I remembered another book I love called Terrors and Experts by psychoanalyst Adam Phillips. And he writes that psychoanalysis can be useful as a critique to the whole project of wanting authorities.
Yes.
So is it possible?
Yes, that's a beautiful any of his phrases.
For sure. Is it possible that psychoanalysis or psychotherapy, in contrasting with the medical model, is it possible that it's a lot of times on the side of not knowing?
Yes, very much so. And even though some of the analysts in the middle of the last century adopted a tone that we already know the important things, good analysts have always had the attitude of going in with curiosity and expecting to be surprised. That was something that Theodore Reich wrote about in the 1940s. Donald Stern sort of called our attention to it again in his concept of courting surprise. But there's a chapter, I think, in Listening with the Third Ear on surprise and the psychoanalyst, which captures that attitude. And certainly Freud had that attitude. He kept learning, he kept revising his theory.
And being surprised.
And being surprised.
And it's interesting also because when we talk about this contrast between the medical and the contextual model, there is also sometimes, I feel, the issue of time implicit.
Yes.
And, talking about your own personal analysis and training, you wrote that where I was trained, we used to say the first year is just hello.
Right.
I love this idea. So they told you that the first year of training or of analysis, maybe?
The first year of analysis is just saying hello. You're establishing a relationship in that year that can be trusting enough that people can really go into their dark places in subsequent years.
And do you feel that time and time for oneself, or a lack of time, this kind of lack of time or time for oneself, do you think it's a symptom of our age in a way?
I do. I do. We are certainly much more interested in the quick fixes of our behavior than in in-depth understanding and growth. I'm working on a book now on overall mental health or psychological well-being as therapists have conceptualized it over 100 years of psychotherapy. And what we hope patients get to is not just symptom relief, but things like affect tolerance and regulation, and the capacity to mentalize other people, and the capacity to reflect on the self, to have object constancy, to have a more secure attachment, to have realistic self-esteem, to be able to be resilient after stress, to be able to accept what can't be changed, and to grieve and to move on rather than getting locked into the position of complaint or victimization. Those are things that are growth processes that take time.
Yeah. So
not that I don't believe that short-term and crisis intervention therapies aren't very, very valuable.
Yeah. Do you feel in your own practice has this issue of the time or how people use their time, has it changed significantly, you feel, in the people you see in therapy? Do they feel more pressured in any way? Or
Yes, I think, well, partly because of the influence of the culture. People now come to me and they expect me to apply a technique that will get rid of their symptom in a short period of time.
That happens more now?
It happens more now.
Okay.
People will Google things and they'll be told that, for an anxiety disorder, go to a person who will do a particular set of interventions. But people are not stupid, and if their anxiety disorder involves a much more complex sickness of soul, you know that it's not going to go away in 6 or 8 sessions. So that I don't find so hard. It's interesting, I noticed something of a change in myself as I am now in my 70s. I am a little bit less patient with certain kinds of psychopathology than I used to be. I think narcissistic issues, for example, I want to get the person to, people with narcissistic kinds of psychologies often destroy time. It's just a phrase that Kernberg has used. I don't know if it's original with him, but they act as if they have infinite amounts of time. And I find myself trying to focus them more than I once did. Even those that I think of as needing a kind of Kohut, supportive mirroring, still, I think, put a little bit more pressure on them. Where do you want to go with this? What changes are you making in your life? How is the knowledge you're getting here actually having an effect on how you're behaving and the improvement of your relationships? I think what changed is my own inner sense that time is limited. And that's something I've always had to some degree because there's been a lot of loss and death in my history. So I have a sense that life is precious and short and you should do what you can in the time you have. I've had that from very young. But it's certainly stronger when you hit your 70s and you start framing, I have maybe 10 more good years, maybe 20 if I'm really lucky, and it frames everything.
You mentioned you were writing a book on mental health.
I
wanted to ask you about that because in the recent years you've done some lectures on mental health. I would really recommend people to check out on YouTube. There are some. What made you decide now was the good time to start focusing again also on mental health?
Well, it's partly a response to my editor, Kitty Moore, who's been pushing me for years to write a book that would sort of cross over to a more popular intellectual audience, the kind of audience for Blink or Judith Viorst's Necessary Losses. And I thought I would like to do that. Partly my identification with Theodore Reich, who wrote for a larger popular audience about psychoanalysis. But I wasn't inspired by a topic. But then when we did the first edition of the Psychodynamic Diagnostic Manual, and I was going around doing talks on it, I would say to audiences, the DSM is very useful for some things, but it doesn't have a concept of health, And and then I would list several of the things that I listed to you a few moments ago.
Mm-hmm.
And I saw people wildly writing them down. And afterward, they would say to me, this was especially younger people, that was a great list that you...
Tell me that again. Yeah, what was that?
There hadn't been a kind of cultural discussion about what is mental health since probably the early to mid 1970s, when there was a lot of attention to, are we just trying to adjust people to a sick society? There were a lot of ways we were talking about that at that time. And that conversation has disappeared. So that's what got me thinking it would be very nice to revivify that conversation, because under the pressure of insurance and drug companies, we are pressed to think of psychotherapy as simply getting rid of a measurable symptom.
Yeah.
And certainly that's a valuable thing to do, but there is a lot more to psychotherapy than that, and it needs to be articulated within the context of all the cultural differences about how people define mental health. There has to be some conversation about what we're trying to help people toward.
Yeah, achieve. Yeah. I remember in one interview you gave in 2008, I think it was with 𝗔𝗯𝗲𝗅, that you said that the United States was originally overvalued psychoanalysis because it was new.
Yes.
And now psychoanalysis isn't new, and we're inclined to believe that there's nothing valuable to take out of that. This cultural vision of what's new is better, how do you think it ties in with these concerns that you've been expressing about psychotherapy research?
I do think that's a conceit of certain Western cultures, especially my own. For example, there are some academic journals that don't want you to cite anything that's more than 5 years old in your references, as there was no good research done prior. And it's such a contrast. One of the things that has been a blessing of my life in recent years is the opportunity to go to other cultures and talk to therapists there, including non-Western cultures like China and Singapore, Iran, Turkey. Some tribal people like the Maori in New Zealand have talked to me, or the Zulus in Australia, or some Native American therapists here in the United States or Canada. And they have such a different mentality about the wisdom of the elders that are part of their culture. And you can be skewed toward too much dependency on the authority of the elders, but you can also be skewed toward too much assumption that novelty and progress going to solve everything. In the United States, we have a kind of myth that we're new and everything new is better, and there are unlimited resources, and psychological growth is sort of like technological growth or scientific progress. And in some ways, psychological growth involves eternal verities that the wisdom traditions capture better. That there's always love and hatred, that we have to accommodate to things that are beyond our control. Wisdom like that.
I remember Marv Goldfried, he argued also about this concern about this, what's better, what's new is better, that this also influenced, of course, the development of schools of psychotherapy. And there would be like 500 schools of psychotherapy because what was new was better. It does seem like a huge problem for scientific development in a way. Go ahead.
I think it is. And I think in psychology and psychiatry and social work, the mental health professions, the reinforcements, the incentives are all for critiquing the old and getting your name out there as doing the new thing. The kind of integrative stuff that most therapists, in my experience, are highly integrative. They don't tend to organize their whole psychology and identity around, I believe this and I'm not that. most of us are grateful for any orientation that helps us solve a problem with a patient. But in academic life, the best way to move forward is to critique what's existing and to get your name associated with something that's brand new.
Connecting what you're saying, some weeks ago I was watching your DVD tape, 2001 DVD tape for American Psychological Association, 3 Approaches to Psychotherapy, where it's you representing psychoanalytic psychotherapy and 𝗔𝗹𝗲𝘅𝗍𝗍 cognitive therapy and Les Greenberg emotion-focused therapy. And I was struck by the debate afterwards that everyone, sure, there were some disagreements, but there was also a lot of consensus between the 3 of you. And it always seems sometimes in psychotherapy that we're doing sometimes the same things with different languages.
Very much.
I would like to know from your... so it got me interested on your relationship to other orientations. So I'd like to know, in recent years or not so recent years, has there been any very significant or influential author, book, or anything from another orientation not psychoanalytic?
It hasn't come to me so much through books. Mm-hmm. It has come from colleagues.
Discussion.
Yes.
Yeah.
It's come from, although Paul Wachtel's book was very influential to me early on, even Dollard and Miller, I liked in their integration of learning theory with psychoanalysis way back. But it's from getting help from colleagues when I've run into a problem that my own orientation doesn't seem to get me any traction on.
Yeah.
And the first time it happened was in the early 70s when I had a family with somewhat elderly parents and a 13-year-old girl who was completely out of control. And I did a very systematic intake, and I felt I understood what the family dynamics were, but my understanding wasn't helping them help the daughter calm down. And so I consulted with a behaviorist colleague at the time, and she said, well, why don't you have the family pay the girl, I think it was a quarter, 25 cents at that time, inflation, for every day that she doesn't throw a tantrum.
A reward.
Yeah. And that just wouldn't have come to me because my mind was organized around understanding, developing meaning, making the relationship. But that worked like a charm. It calmed her down enough that she could actually participate in psychotherapy. And it was a humbling experience for me, who at that point in my young life was very deeply and somewhat arrogantly identified with the Vedic tradition. But patience will humble you, and your colleagues will help you. I get a lot of people who come to me because they've been trained in a bunch of techniques, and they say they were not trained in how to think about the whole person. And I've been helped by cognitive behavioral colleagues and continue to be helped by them.
Yeah.
Out of clinical necessity. I do find that, one of my closest friends is Brenna Bree, who's a Skinnerian. And at Rutgers, she and I used to sometimes show a tape of a family or a person and then talk about how each of us viewed it. And we did use a completely different language. I'd be talking about defenses and she'd be talking about reinforcements. And then we would make exactly the same recommendations.
Incredible. Yeah, of course.
It was fascinating.
Yeah, the Babel Tower of psychotherapy. That's incredible. I really recommend also people reading your 2013 paper, The Impact of My Own Psychotherapy on My Work as a Therapist, where you write about your relationship with Lou and how it influenced you.
Yes.
I'd like to play a little game with you, a little challenge, which is, if you were to go back to analysis nowadays, how would you describe your ideal analyst?
I would want somebody with a big heart and a lot of life experience. And I think with a lot of personal confidence, because I have to take into account that some people have a transference to me and couldn't see me as an ordinary suffering person. So I'd need somebody who approached me as an ordinary patient and not with the idea that I was some kind of superstar.
Yeah.
So that would be very central to me. Could the person see me without too much of a pre-existing sense of who I am? I would want the person to be intelligent, but they wouldn't have to be brilliant. That's one of the things that I learned in my analysis, that intellectual firepower is very nice, but it's no substitute for an attitude of curiosity and respect and an interest in learning from the other person.
Yeah.
Those things would be important to me.
Yeah. So intellect is maybe sometimes necessary, but not sufficient. Talking in 𝗔𝗹𝗲𝘅𝗍 terms.
Yes.
Okay. Nancy, I'd like to finish our talk with one last question that I've been asking all of our colleagues in these interviews. And you already mentioned that when you wrote to Theodor Reich, you asked him for some career advice. So yeah. I'd like to finish off by asking you, what advice would you wish to have received when you were starting out as an analyst?
It's hard to answer because I think I got very good advice. I had good supervisors and good teachers. It's interesting that question stops me, because you're framing it as what I wish I had been told. Requires me to find what I had not been told that I wanted to be told.
Exactly.
And I think I have so much gratitude for the people who taught me without wanting to make me over into images of who they were.
Yeah.
Without teaching me what the rules were that I had to obey. Who put the emphasis on really trying to understand people.
Yeah.
And that would be the advice that I would pass on, is, don't let your theory overwhelm your natural human instincts about what might meet this other person as a fellow human being. Don't try to apply a particular system so much as start with just trying to understand.
In true humanist fashion, in a way.
Yeah.
Nancy, you certainly helped me, and I hope a lot of colleagues also in that path, so thank you so much for this opportunity to talk.
You're very welcome. It's been a pleasure.